Namaskar. Frozen shoulders are a very common problem nowadays because all of us have become digitalized due to this COVID problem. Laptops make us their slaves, and we barely realize the posture which we take while using it, the muscles which we are using, like neck muscles, shoulder muscles, back muscles, how we are using. We are not aware at all about it, and so we strain our body. Also, we neither relax our muscles nor we exercise our body. Frozen shoulders are commonly seen in people who have diabetes or those people who are physically inactive. The main symptom is the pain and stiffness of the shoulder joints, and it makes it impossible to move. It has 3 stages. The first one is called as a freezing stage. Second is frozen stage, and the third one is thawing stage. The freezing stage is characterized by severe pain while moving the arms, and it may hurt more during the night. There is very limited movement of the shoulder in this stage. The next stage is frozen stage. In this stage, the pain might reduce, but the stiffness increases more. Doing daily activities becomes challenging, and it might last for 6 to 12 months. This completely depends on individual's diet and other cofactors. The last stage is thawing stage. In this stage, the range of motion goes back to normal, and this might take more than 6 months to even 2 years. So, let me give you some tips. In case of severe pains, ice pack could be applied to the joint. Before exercising on moving the joint, hot fomentation for a minute is recommended. Direct blast of AC or fan should be avoided totally. Maintain normal room temperature. Heavy weight should be avoided at all costs. Even lifting of a child should be avoided. Having proper erect posture really helps in management of this frozen shoulder, and this also makes the healing quicker. Next, yoga stretches. Always warm up your shoulders before performing your exercises. The best way to do that is to take a warm shower or bath for 10 or 15 minutes or do hot water fomentation. Some stretches that can be done are: first, Gomukhasana stretch with towel or any other support. Hold one end of the towel above your head and the other hand at the lower back. Stretch the towel up and down. Move your hands up and down as much as possible. Repeat this exercise 5 to 10 times. Second is Samkonasana with support. Third, wall stretch. Keep the elbows and palm on the wall as the model is doing. Gently move your hands up as far as possible and then slowly, gently bring it down. Repeat this set for 5 to 10 times. Fourth one, towel stretch. Hold one end of your 3 feet long towel behind your back and grab the other end of the towel with other hand. Hold the towel in a horizontal position. Use your arms to stretch them in different directions, side to side. Take both the arms up and side to side. Take both the arms behind and side to side. So in these different ways, you have to exercise your shoulders as well as arms. Stretch the hands in such a way that the pressure on the affected arm is less. Good arm is used more, and that's how you should try and help each other. Next, relaxation technique. All the diseases are connected to mind. So switching off, resting in between is most essential. Therefore, some relaxing techniques that you can do are: 1. Nishpanda Bhav for really mind more than body. Second, Shavasana for every part of your body. Third, Balasana. Fourth, Yoga Mudra. One more posture could be Makarasana, and then finally lying down on the back and using diaphragm, that is pranayam number 4. Meditative techniques would really be helpful to take you away from the negative emotions. And this would help to reduce your stress drastically. The treatment for all the pains and suffering ultimately comes to a good meditation. Now, let's understand how to sleep if you have frozen shoulder. If you have a frozen shoulder, it is very necessary to support your joints with enough cushioning. When you use enough cushioning, the pain doesn't get worse for the following day. Don't lie down on carpet or chatais. The surface has to be little softer. When you are doing asana, it need not be too soft, but still it should be softer and not hard at all. Next, food. Diet plays a vital role, as frozen shoulder is seen typically with diabetics. Controlling blood sugar would automatically reduce the pain in your shoulder. So use bitter gourd, gooseberry, or what we call as amla, and any other bitter things daily in your meals. Green leafy vegetable like spinach and kale, black grams and soya products can do wonders when you consume them daily. Rice, potato, bananas, different cereals, mangoes, pears, grapes, or processed food all should be avoided. Rice, if taken, should be unpolished rice. That would be okay. Diabetes also leads sugar in urine, and grief, worry, anxiety also creates lots of problem with our health. It creates a deep influence on our metabolism, and sugar would be appearing in urine. It is observed that in cold climate, in cold countries, frozen shoulder is very common. So person should maintain warmth of the body. The part which is affected should be little bit additionally warm. Wear some additional clothing to see that that area is always kept warm. That would really help. Use hot water bag. Wear some such clothes which would protect that area from breeze, from AC, from the external cold atmosphere, and that would help in management of frozen shoulder. The pain is just a symptom of stress. So resting is so much useful, and just see to it that mentally and physically we are free from pain. We take pain more at mental level. We get hurt, we have anxiety, we want something and you don't get, so you are frustrated. All these things are going to help you. You will have more pain, more problems in life. So avoid all such type of a mind. Everybody should create a regime of exercise very regularly, and mentally try and be happy, cheerful, enthusiastic. Try and see that that warmth, energy is always there with you, and you would be out of pain and problem. So take care. Namaskar.